The believers usually clap after prayers. And before you take your seats, can I have the national anthem sounded as well as the East African anthem?
Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tulilinde, tuajibike, tuimarike, umoja wetu ni nguzo yetu, idumu jumuiya yetu.
You may take our seats, ladies and gentlemen. I want to give you confidence that the alarms you hear are false alarms for now, but everyone is safe and everyone is in good place. We want to welcome you in a special way to this great occasion. Today is not an everyday kind of a day, but it's a rather unique day to us who are in the fight against HIV and AIDS as the agenda of meeting the 95-95-95. I want to recognize the arrival of the Ambassador of the United States of America, Her Excellency Natalie Brown. Let's clap for her. You're so much welcome. In the midst, we have our chief guest, that is the Minister of Health, Dr. Jen Ruth Cheng. Let's clap for her. She's here with us. Thank you so much, Mama, for keeping time and coming to grace this occasion. We have the Director of Public Health, that is Dr. Henry Mwebesa, is here with us as well. Good to see you, sir. And from one of our key partners, we have the Divisional Vice President of Africa, Eastern Europe, Middle East, and Global Accounts. That is Abasem Bibi, is equally here with us. Good to see you. Friends, as we convene today, the conversations we're having here are about HIV and AIDS. And the government of Uganda is very so much committed in sustainable HIV pandemic control under what we call the super fast track framework that aims at achieving the triple 95 HIV testing and treatment targets by 2030. While the public health response, the leading component of the country's multi-sectoral response to the HIV and AIDS pandemic control will play a vital role, if not the deepest, in the attainment of this goal. The major gains made in reducing HIV and AIDS, a couple of them have been registered. There is a reducing HIV incidence and mortality correlating with the increased coverage and uptake of the critical HIV prevention and treatment services. And indeed, by the end of 2017, nearly 80% of HIV-infected individuals were already enrolled on the ART. Slightly higher proportion were already diagnosed and aware of their HIV status. While increasing HIV and AIDS prevention, care and treatment in the recent years has been fairly successful at different demographics, saving lives and preventing new infections, long-term sustainable HIV epidemic control requires intensive and increased effectiveness of HIV treatment and prevention if we are to avert the new infections and HIV-related mortality. Now, what does this mean? This means we have a number of outcomes we're looking at as a country if we're going to achieve this. In line with all the other considerations, the HIV epidemic control goal in this strategic plan, to those of you aware of it, it will be to have the new HIV infections among adolescents and adults reduced by 50%. And the final mother-to-child transmission rate of HIV, including the breastfeeding, is reduced by 5%. The high-quality HIV care and treatment services are optimized to achieve the 95-95 linkage to treatment, virus suppression, in at least 95% of the PL-HIVs enrolled on the ARTs. Now, the strategy looked at a couple of things, and one of the first one was reduce the new adolescent and adult infections. In this, to achieve this, we need increased identification of people living with HIV and AIDS, testing and link them to the ART treatment, increasing the uptake of the targeted high-quality self-male circumcision services. And the males who are here, let's clap for that. At least we've seen the male circumcision going on in the different areas. I want to appreciate that from the ministry. Strengthening comprehensive HIV prevention, interventions, targeting the adolescents and the young people. Friends, as we meet here today, and we are launching the self-testing services among the youth in higher institutions of learning, it does not only stop in that very space, but it expounds and goes to our communities and our homes. We can have all these conversations, and believe you me, by the end of this conversation, you and I will know how exactly we are going to go around this. Allow me to welcome the Director General Health Services, Dr. Henry Mwebesa, to give us what is on the other side as a country waiting for this. Let's clap for him as he comes.
Thank you very much, MC. The Honorable Minister of Health, Your Excellency, U.S. Ambassador to Uganda, representative of the WHO, country representative here present, our development partners, the Division of Vice President for Abbott, Eastern Europe, senior colleagues from Ministry of Health, implementing partners, ladies and gentlemen. First of all, good morning. I also want to welcome you to this launch of the Abbott Checknow HIV self-testing kit, which is another landmark in innovations for self-testing. As many of you will know, this joins other innovations which have been in the country in the area of self-testing. I'm sure many of you know that many people test themselves for diabetes in their homes. Some can even test for themselves for malaria using kits at home. And more recently, we're doing a lot of testing, at least in many developed countries, for COVID. It hadn't peaked so much here, but there was a lot of self-testing for COVID. So this also joins those innovations among others. I want to thank in a special way the Honorable Minister for finding time to come and launch this innovation amidst her very, very busy schedule. I honestly know her schedule today, and it's not something I would envy, because I know she'll be running between venues. I want also to thank in a special way Ambassador, Her Excellency Ambassador of US, for always being there for us in the areas of health, innovations, and prevention. And I also want to thank all dignitaries who are here. Ladies and gentlemen, Uganda has made significant progress in HIV response over the years. And I know many of you will know. And I think the MC also did a good job to summarize quite a number of improvements. So I'd like to thank the government of Uganda, at least on behalf of Ministry of Health. I want to thank the government of Uganda in general and our development partners for this success in the fight against HIV. I also want to thank in a special way His Excellency the President for his personal drive to end HIV in this country, and more recently, even in the region. Many of you, I expected also a clap there. Thank you. We are aware, many of you have, from the recent studies that we have had. Ooh, I thought somebody had helped me with that light. We are aware from the recent studies, especially the survey of 2020, which we call UFIA, but many people may not know what UFIA is, but it was a survey in HIV, that what we found about the 3 UN global targets of the 95, 95, 95. And briefly to our students from the universities, we expect that at least 95% of the HIV patients have been tested and are aware of their HIV status. Of those, 95% have started on treatment, and of those started on treatment, 95% have their viral load suppressed. So when you hear us talking about 95, 95, 95, that's what exactly we are talking about. So from the study I've just talked about, it was found out that the first 95, we are really not doing very well. We are doing well, but we have not achieved the 95. That means for all people who could be having HIV, 95% of them, we have not achieved the percentage of 95% of them knowing that they have HIV. That is the first target. So the first 95 remains below the target. This is mainly because, and it's attributed mainly to children, adolescents, we the men, and some key populations. That group I've talked about, those groups, many of them don't know their HIV status. And I want also to implore you, the younger students who are here, that you need to know your HIV status. So we must therefore scale up testing programs to bridge that gap of making sure everybody knows his HIV status. And what we are launching today is part of that drive, part of the innovations to make sure that we all know our HIV status. And this self-testing drive, which is being launched today, is recommended and supported by WHO, but also fully supported by the Ministry of Health. HIV self-testing is a critical strategy for delivering HIV testing services for populations that have not come up openly to the traditional testing methods. Because there have been avenues for testing, but some people have not been able to come to do tests and to know the HIV testing. So we bring this innovation because it comes, of course, even the previous ones had confidentiality, but we bring this one because it offers confidentiality, it is convenient, you can sit in your sitting room, you can sit in your university room and test yourself. And it gives you a good environment. And our guidelines in the Ministry of Health now for testing for HIV have now incorporated this as one of the approaches to do self-testing. And we have worked with Abbott and Lifecare Diagnostics to explore scale-up strategies. After this, how are we going to take it beyond here? And this has been done through a pilot which we did in universities, and we did this with a subpopulation of 20 to 34 years in 8 institutions of higher learning. Honorable Minister, Your Excellencies, ladies and gentlemen, the campaign is using a kit called Checknow. I think it is very well shown there, which was developed by Abbott, mainly to extend HIV testing services. And this will further promote linkage to care and to prevention services. Because once you test, then you have to be linked to treatment. And also, once you test, it will also promote preventive services. Because if I test and I find I'm negative, and this one I'm really emphasizing it for the students. If you test and you find you are negative, you must do everything possible to keep yourself negative. 2, if you test and you find you are positive, then there is a solution. It is not like those old days when people would be positive and you are condemned to death. Now there is a solution. So you seek treatment and you will be helped. So you can see this helps us in both ways. To keep us negative once we've confirmed we are negative, but also to link us to care. So the goal of this campaign is to increase uptake of HIV testing among especially you people in the high institutions of learning. And this kit was tested, distributed through peers. We worked with peers within your universities and tested it in 8 universities. We did it in Makerere University, we did it in Chambogo University, we did it in Mukono Christian University, Nkumba University, Kampala International University, Makerere, MUBS, and Indeja University and Inkozi University. And it is targeting 30,000 youth in these high institutions, and a maximum of 15 peers have been identified, and a total of 120 peers have been trained. And these peers are the ones who have been distributing the kit and also teaching their colleagues on how to use this kit and how to test themselves, and also guiding them once you test, what next, how can you be assisted, and the like. I think I can summarize that part like that. Now, how do we deal with the positive results? Positive cases, as I have said, if you test and you find you are positive, you can still work through the peers who have been helping you, to training you to do the self-test, and they will link you to the treatment facilities. Honorable Minister, we also have a package on application for capturing the information and the data. And this application is similar to a mobile money application. I think the programs at an appropriate time will demonstrate, which has been deployed to individuals to transmit their self-test results and enable peers to monitor and test the distribution for ease of supply chain management. Let me just quickly highlight a few of the tremendous impact that we have observed. For instance, already of the 10,000 students and peers who have received these kits already, which indicates, and just in 2 weeks, which indicates a high demand for self-testing. And of those who tested, 3,800 reported that they were testing for the first time. Can you imagine? 10,000 people, 3,818 were testing for the first time. And that is at 8%. And that may even be the same picture across the country, because you have these university students who are enlightened, but 38% are testing for the first time. So you can imagine in the rural areas where people are not as enlightened, it could even be higher. 2,400 of these self-reported their HIV status through the mobile application I've talked about. And with strengthened peer support, we are following them up. 708 individuals proceeded for standard of care testing and HIV treatment at nearby referral health facilities. The ability to link HIV self-testing users to standard of care promotes the utilization of the preventive services, as I have talked about already. Honorable Minister, ladies and gentlemen, we shall continue monitoring the progress of the pilot. As I have said, we have started as a pilot, but after this launch, we shall go in overdrive to make sure that we distribute the kits in many universities. Our target is 30,000, but we look forward to even going beyond that target and accessing many more people so that they have that services. And Ministry of Health will continue working with life care diagnostics to promote this innovation, because as we said, it gives the people the confidence to test themselves at home, test themselves in their universities. Somebody can lock his university room, does his test, and then, depending on the results, connects with the peers of the next way forward. So finally, in conclusion, I want to thank you all for coming for this important function, this important innovation that will increase our opportunities for testing. I want to thank once again the Minister for giving us this time, and Her Excellency the Ambassador. I want to thank Abbott for this innovation, like many others that you have done in which we are collaborating, and we really appreciate this relationship. And Lifecare Diagnostics for linking us up to Abbott and being operational and managing the operational logistics for this innovation. I want to thank the peers. Thank you so much for innovation, because you'll make us succeed or you'll make us fail. And I want to believe you'll make us succeed, and we count on you. And finally, I want to thank the program manager and his team for a job very well done, and all the successes and achievements that we have registered so far. Thank you very much.
In a special way, let's thank the DG once again. And yes, I'm working with my friends for purposes of inclusion. Honorable Minister, in the strategy, inclusion was key. That's why we have the sign language. This is my other colleague is called Jagwe from NBS doing the sign language. What a great moment to liaise for the good of the country. In our presence, Honorable Minister, we have Makerere University. They are here with us. Let's clap for them. We have Chambogo University is here with us. We have Nkumba University. Let's clap for them. UCU University, they are here with us. Nkozi, Uganda Matters University is here. We have our friends from MUBS, they are here. And those from Undeje University. And finally, Kampala International University. Let's appreciate them. In a special way, allow me to appreciate the team from Abbott for this innovation. I deal with men, and men we fear to be tested. We fear to go with our wives to get tested. This kit is not only an innovation of health, but it's an innovation to give confidence to relationships. In a special way, I still want to say that the optimization of this agenda, according to this strategy, we are looking at optimizing quality HIV care and treatment. This innovation strengthens linkages to antiretroviral treatment. It optimizes the treatment regimes, and it's going to help us improve on the retention, adherence, and the treatment. But above all, strengthening client treatment monitoring and confidence. I really want to appreciate you for that. Thank you so much. We should have had a dean speak on behalf of the Makerere University, but in the absence of the dean and the representative, allow me at this juncture, ladies and gentlemen, to welcome Mr. Bassem Bibi, the Divisional Vice President of Africa, Eastern Europe, Middle East, and Global Accounts from Abbott to come and address us. Let's make him welcome, comrades.
Thank you.
You're welcome.
Good morning. What a great day. And really, I'm delighted to this day. First of all, Honorable Minister of Health, Dr. Jane Asang, Your Excellency, U.S. Ambassador to Uganda, Natalie Brown, distinguished guests, ladies and gentlemen, and of course, Dr. Hani, the Director General Health, and Dr. Chal, Foreign Representative of WHO, and of course, the student, the university, all of you, welcome. It is my pleasure to begin my congratulating to the Ministry of Health for the outstanding achievement in making Uganda rank among the 14 countries we have achieved the UN AIDS goal of 95-95, which is, we heard the speakers previously talking about it. This remarkable accomplishment will not happen without your never give up attitude. Dear Minister, really, what you have done to your country, it's really outstanding efforts from your side. This launch come at the right time following the African Union declaration that was signed last month by heads of state during the African Union 2023 Heads of States Summit, pledging new commitment to end AIDS by 2030. ABIT is proud to be a public-private partner to the Ministry of Health, the National Medical Stores, and the Uganda National Health Laboratory Service in advancing health outcome for all Ugandans. We are thrilled to see the progress we have made together in utilizing POC technology to improve healthcare in the country. HIV testing is an essential gateway to initiate HIV prevention and treatment service. However, many individuals who are at high risk of contracting HIV or who are already infected with HIV do not test at a high enough rate due to various reasons, such as a lack of accessible service, stigma, and concern associated with confidentiality. ABIT always making sure that those testing diagnostic to reach every remote area and really to be affordable to all nations. The introduction of HIV self-testing service using Checknow, particularly among youth at a higher education institutions, is a key step in bridging the gap between testing and treatment that many countries are facing. Over the past few years, ABIT has been committed to supporting the Ministry of Health and its program, strengthening and near-patient diagnostic services offered in health facility across the country. Through our distributor LifeCare Diagnostic, and we are very proud of them, we have provided regular site visits to most facilities and collected data through smartphone application and connectivity technology. And that's the future. Decentralization is very important for the future. And we have those programs that we are really enforcing this with our partner LifeCare to bring technology and digitalization that can be available between all the hand of the government and Ministry of Health and the program so that they can check on a weekly basis, daily basis, monthly basis, all their data and what's happening, and they can move fast with all their programs. We reiterate our unwavering commitment to supporting the Ministry of Health, and we look forward to maintaining this great collaboration to help advance healthcare for people in Uganda. For HIV and in the future area conditions such as malaria, and support antenatal care, which is mother to child. With that, I would like to thank the Ministry of Health, Your Excellency, U.S. Ambassador, and of course, the encouragement of the student of the university, which is they are the future of Uganda and the future to lead Uganda, I'm pretty sure. You are the future. Thank you very much.
I appreciate you so much, Mr. Bibi. Thank you so much. The innovations you've promised us, I can't wait to see that even more. And in the interest of our development partners from the global scale, allow me to invite Dr. Charles Njuguna, who happens to be the incident manager and emergency preparedness and response cluster lead, to give us a few remarks before we proceed in the other speeches. Let's welcome him again.
Thank you very much, Honorable Minister of Health, the U.S. Ambassador, Director General, the Vice President of Abbott, all the invited dignitaries, ladies and gentlemen, good morning. Good morning. Yeah, I'll be very, very brief. First of all, to mention that I'm here to represent the country rep of WHO who is away. And as WHO, we are very happy because of this very important function that brings together, especially youths from universities. As you know, Uganda has been one of the countries that have performed very well in the fight against HIV. Those who know the history of Uganda, Uganda has come from a very long journey. You know, there are times the HIV prevalence in this country was quite high. But the government of Uganda has demonstrated leadership in combating HIV in this country. And when you look at the epidemiological trends of HIV in this country over the last 2 to 3 decades, you'd come to appreciate that a lot has been achieved. But also let us remember, apart from all those remarkable achievements, the enemy of best is good. So we have not reached where we want to reach. So we must continue putting every effort to achieve the agreed upon targets, the triple targets, and ensuring that we are going beyond those targets. We are here to emphasize the importance of testing, and especially among the youth, very, very critical, because this is a very active population. You need to be responsible enough to ensure that you protect yourself, but also protect others. Let's also not forget about some of the key messages, like emphasizing the need for abstinence. I know that our society has changed over the years, but there are those values that we need still to emphasize, that for our young people, abstaining is very, very, very important. And if you cannot, then we'll talk about the other things. But let's not forget about those important measures like abstaining, because that's how you prevent yourself from HIV. Before I sit down, let me also say to those that are adults, not just the young ones, the risk is still there. And therefore, there is need for us also to be able to govern ourselves and to restrict ourselves and to stick to our partners. Those are important messages. Yeah? You know, and this is off cuff, Henry Ford, when he was celebrating his 50 years in marriage, he was asked by the media people, how have you managed this? And he said that, Henry Ford is the man who is behind the Ford vehicles. He said one thing, I stick to one model. I stick to one model. And he has said he has kept, stick to one wife over all those years. So even for us that are adults, let's keep to one model. Thank you very much. And I think we'll be able to prevent the spread of HIV. Thank you very much, Honorable Minister, for giving me a chance. I was not expecting to make remarks, but thank you very much. And thank you, all of you.
Thank you so much, Mr. Njuguna. Stick to one model. Tell your neighbor, stick to one model. Just turn to your neighbor, tell your neighbor, stick to one model. That is if he's not a Muslim. But regardless, you need to be safe in one way or the other. Friends, allow me at this time to welcome our very dear partner and friend, Her Excellency Natalie Brown, to come and address us before we have our minister address us, and thereafter we shall proceed. Let's welcome her.
Thank you. Good morning, everyone. It's hard to, I want to, Happy New Year. Can I still say that, although it's already March? Time is passing. Good morning, everyone. Happy New Year. Honorable Minister of Health, Dr. Jane Ruther Chang, Dr. Henry Mwabuesa, Director General of Health Services, of course, Mr. Bassem Bibi from Abbott, representatives from the UN agencies, from WHO, members of Parliament, all of the representatives from the universities, our development partners, civil society, certainly all of the young people here, all of the students, friends, colleagues, all protocols observed. I am really very pleased to join you all this morning as the Ministry of Health launches the Checknow HIV self-testing services among youth and higher institutions of learning. The campaign is a country-led public-private partnership demonstrating how together we can foster innovative solutions to society's most pressing problems through collaboration with philanthropic organizations and private businesses. And today's launch illustrates the important role private sector entities like Abbott Labs can play alongside the government of Uganda with the U.S. President's emergency plans for AIDS relief, or as you may know, PEPFAR, and other partners in the effort to achieve epidemic control of HIV/AIDS. Innovative solutions such as HIV self-testing are essential to reach undiagnosed adolescents and young people, the critical first step to starting HIV treatment, which ultimately supports young people to live full, healthy, and productive lives. Now, a recurring theme during my time here in Uganda has been stigma, and we just heard Mr. Bibi address that. People, and especially younger Ugandans, are fearful of getting tested, and if they're positive, of being seen receiving life-saving treatment. And I hope the availability of Checknow HIV self-testing encourages younger Ugandans to take the initiative to get tested earlier, and if necessary, to get on treatment sooner, so that they can live the longer, healthier, more productive lives they so richly deserve. We're especially thankful that Abbott, an American company, is investing in Uganda and providing key services in the health sector. For about 4 years now, Abbott has carried out a public-private partnership agreement with the Ministry of Health to provide diagnostic services for HIV, COVID, and malaria. Abbott's excellent example is proof that linking American private sector technical expertise with the talented human resources that exist in Uganda can lead to improvements in the health of all citizens. Abbott's expertise and experience serves as an inspiration to encourage more American companies to invest in Uganda in a way that prioritizes transparency, accountability, and coordination with the abundant talent found across the country. So the recent successful effort to combat Ebola in Uganda is a powerful reminder of the importance of providing health care for all. When the outbreak began last September, time was of the essence, and it was imperative that the ministry and development partners quickly surge resources to provide dignified, quality health care for any individual exposed to the virus. This not only saved many lives of people who contracted Ebola, but it prevented community transmission, which could have turned the outbreak into a catastrophe. We never asked who was receiving health assistance, but rather focused on the universal need to keep all of us healthy. This approach should guide all citizen engagement with the health sector. If individuals, especially those from vulnerable or marginalized groups, such as fisher folk, adolescent girls and young women who unfortunately experienced an increase in HIV/AIDS infection during the COVID-19 pandemic, men who have sex with men, female sex workers, drug users, and incarcerated, if they do not receive the health care they need, it ultimately costs us all, as we are deprived their contributions to the economy and to the communities, and ultimately end up paying more for care that would have been more economical and more successful if addressed earlier. So next week, experts from the U.S. mission, some of whom are here with us today, and their counterparts from government, implementing partners, and civil society will gather in South Africa to discuss updates for the PEPFAR Operational Country Plan 2023, or COP23 for Uganda. And it's so relevant that we're here today to launch Checknow, because innovation and building transformational partnerships with a diverse set of private sector stakeholders, including private for-profit institutions, social enterprise foundations, and private health sector delivery systems, represent a strategic pillar of PEPFAR's new 5-year strategy. Through these partnerships, Uganda and PEPFAR can create connections with complementary programs, as well as align strategies, programs, and operations. Additionally, these partnerships contribute to reducing costs by avoiding duplication of efforts and helping countries shape their markets for new innovations, while improving the coordination of health systems and security investments, promoting regional manufacturing capacity, advancing digital health, and bolstering the health workforce, all of which keep us on the path to ending the HIV pandemic as a public health threat by 2023. PEPFAR, working in partnership with Ugandan people and our fellow Americans, will continue to leverage U.S. and local ingenuity and innovation from across sectors to rapidly translate the latest tools, technologies, and scientific breakthroughs into program implementation to better serve the community. Furthermore, in collaboration with local institutions of higher learning, we can utilize the capabilities of U.S. and local academic institutions to deploy research and scientific expertise in support of local African institutions and on-the-ground programming. So I want to thank the Minister and the Ministry of Health for providing space for American companies like Abbott to invest and thrive in Uganda. As we launch Checknow HIV self-testing services today, I want to urge that these services be made integral to a status-neutral approach to HIV services for young people, ensuring that all people are directly linked to services appropriate for their health needs, whether that is for HIV prevention or treatment, regardless of HIV status. The progress Uganda has made in the fight against HIV is impressive, yet we know there's much more that we can do to reverse the rate of new HIV infections. Equitable services for all people, especially those marginalized and stigmatized by society, are essential to reaching HIV epidemic control. And this is why PEPFAR, now in its 20th year of partnership with Uganda, and partners like Abbott Labs are so essential. They equip us with the tools necessary to adapt to the current state of the HIV pandemic, and they prepare us to respond to public health threats yet to come. Initiatives like Checknow help provide the tools to fulfill our most basic human commitment, to preserve health and to save lives, which the United States has been doing in partnership with the Ugandans for the past 60 years, working together towards a brighter future. Thank you all, and congratulations, Abbott.
Let's appreciate the ambassador again, Her Excellency Natalie Brown. So a couple of you're wondering, what are we talking about? Let me request that we have attention to the screen, that we understand the self-testing kit. Video, please. Let's give it a round of applause. You have that entire kit. When you get 2 bars, that means you're positive. When you get 1, that means you are negative. Ladies and gentlemen, allow me at this time to welcome the Honorable Minister of Health, Dr. Jen Ruth Acheng, to come and address us. Let's clap for her as she comes. With her leadership, we're in position to actualize and realize these innovations and making sure that as a country we are into the right direction.
Thank you very much, MC. Her Excellency, the Ambassador of the United States to Uganda, the representative of the WHO Country Office, the Vice President, Abbott, and your entire team, student deans and guild representatives from the 8 universities, the representative of Life Care Diagnostics, directors, commissioners, and assistant commissioners from the Ministry of Health, representatives of implementing partners, and representatives of people living with HIV, all distinguished guests, ladies and gentlemen. Allow me on behalf of the Ministry of Health to take this opportunity to welcome you to this important event. I thank you for coming to witness the launch of the Checknow HIV self-test that was developed by Abbott in support of global aspirations to respond to the HIV epidemic. This is being done as part of our collaboration with Abbott and Life Care Diagnostics in a public-private partnership. I wish to thank Her Excellency the U.S. Ambassador to Uganda and the Divisional Vice President of Abbott in charge of Eastern Europe, Middle East, and Africa for attending this function. I thank the Dean of Students and representative of student guilds for your support and for coming to attend this launch in such large numbers. May I also thank the development partners who are here, the UN, represented by Dr. Charles, representatives from PEPFAR and other implementing partners that are here with us. Allow me to appreciate the partnership that has been nurtured between the government of Uganda and Abbott since 2016 that has resulted in collaborations for health in the areas of HIV and AIDS, malaria, tuberculosis, and hepatitis, and has enabled us to strengthen these programs. Today, we add yet another important collaboration with Abbott to support the drive towards ending AIDS as a public health challenge in Uganda by 2030. And I do hope all of you are prepared to ensure that we end AIDS by 2030. His Excellency the President launched a fast-track initiative nearly 4 years ago to end AIDS by 2030, and we all must rise up to the challenge. Our partnership with Abbott is aligned to the Health Sector Development Plan, in which the private sector is a key stakeholder in the scale-up of interventions for disease control. As you have heard from the many speakers today, the partnership has registered significant success in piloting HIV self-testing among the young people in universities. Preventing diseases among this population segment is critical for the future of the country. You will all be aware that we are working with our partners to scale up comprehensive HIV prevention services, care, and treatment programs. We are implementing high-impact behavioral and biomedical interventions, including promotion of abstinence, be faithful, and if you can't do the two, consistent condom use, HIV counseling and testing, medical male circumcision, programs for elimination of mother-to-child transmission, and antiretroviral treatment services. These interventions have resulted in the reduction of new infections and AIDS-related deaths to 54,000 and 18,000 respectively in 2022. I think we need to appreciate this. Today we are here to launch the Checknow HIV self-test kit that has been demonstrated to offer high-quality results here in Uganda. The kit has been evaluated at the Uganda Virus Research Institute and found to be of high quality. This kit will be an additional tool in our arsenal for HIV testing, which is the key entry point for HIV prevention and control interventions. This enhanced capacity for testing will boost the HIV programming and push us further towards achieving the first 95 goal. We shall continue a combination of routine rapid HIV testing algorithm together with HIV self-testing to ensure that we access services to all those that need them. Whereas what we have done well with HIV testing in the general population, there are subpopulations that remain behind. These include children, adolescents, men, and key populations. Self-testing will enable us to reach out to these groups, especially men, as well as groups at substantial risk of infection and those that may be in hard-to-reach areas who may not readily access the routine services. Through self-testing in their convenient environments, programs will be able to diagnose them early for timely antiretroviral therapy initiation. This is vital for improving treatment outcomes and prevention of HIV transmission. The scale-up of HIV testing services will be done following the 2022 Uganda Consolidated Guidelines for Prevention and Treatment of HIV and AIDS in Uganda. The guidelines provide a framework to enable the identification of HIV-positive individuals and linking them to care. Self-testing will be promoted and targeted to ensure high yield for program efficiency. I hope that Abbott will ensure that the kits are affordable to the country so that we are able to plan for them within our limited resources. To enable full optimization of the technologies, it will be important to ensure that we have the requisite financing from our development partners for the procurement of the kits. And I am saying this because I want my dear sister, the ambassador, to take note. It will also be essential that we have adequate resources for demand creation and awareness so that they are utilized appropriately. I call upon Life Care Diagnostics to work closely with the Ministry of Health and the implementing partners to support the activities related to self-care testing using the Checknow. As I conclude, I thank the team that has been behind the development of the Checknow pilot. This includes our team at the Ministry of Health AIDS Control Program, the Uganda National Health Laboratory Services, and Life Care Diagnostics. Perhaps you could stand up and we appreciate you. Life Care, Ministry of Health, National Health Laboratory Services. Thank you very much for a job well done. Let me also thank our development partners who, together with the government of Uganda, are financing these programs. The US government through PEPFAR, the government of Uganda, US government agencies, CDC, USAID, DOD, the UN family, WHO, UNAIDS, UNICEF, UNFPA, UNDP, and UN Women, the Global Fund, Irish Aid, Clinton Health Access Initiative, Unit Aid, and other bilateral and multilateral partners. Let's appreciate them. It is now my honor and pleasure to launch the Checknow Abbott HIV self-test kit and recommend it for use in HIV programs in Uganda. I thank you all for God and my country.
Ladies and gentlemen, let's give our Honorable Minister a round of applause. I want her to officially hold this for archive purposes. This is the moment.
But I need them to come over.
Let me request Abbott, Honorable High Excellency Natalia, please come. Charles Njuguna, DG.
Do we have samples?
Let me have the samples here. Dr. Johnson, please come. I need one more for the DG. This is the moment. You can get on the other side and everyone is there. Okay. We can raise it up, please. Thank you. Thank you so much. Let's give that a round of applause, ladies and gentlemen. Let me request Armstrong to give me my list of those who are going to be awarded. Thank you so much, Honorable Minister. Thank you so much, High Excellency. Thank you so much, Mr. Njuguna. Mr. Abbott, thank you so much. And Dr. Musinguzi, thank you so much, who happens to be the lead at this. Let's clap for Dr. Musinguzi, ladies and gentlemen. He's done incredibly great. So we have a couple of universities of our peers we're going to appreciate today. So when I call you, you're going to be very fast. You come up here with your team lead and we get awarded with this. Let me request someone let me have the team from UCU, Mukono. Let's clap for them as they make their way here. Be fast, be youthful. Let's run faster. People from Mukono, you know we have the traffic there. We are very fast. Let's come faster. This is the team from UCU. They're going to lead all these. Super fast. Okay, this is the team. I'm going to request everyone, make sure that you have your certificate. Everyone, this is what we do as peers, and they're going to send the agenda on the ground. We're using peer-to-peer. Peer-to-peer. Okay, now that they're all here, let me request Honorable Minister to come and High Excellency Natalie Brown to come up here as they take photos for this gracious occasion as a sign of launching this up. Let me request Abbott as well to come back. Please come with your kit if you went down with it. The podium can move. Let me try my best. Okay. Those with the kits, kindly flank them so much of them so that they are visible. Abbott, please put the kit up. Everyone needs to see the kit. Okay. High Excellency, you're in the back. Can you be seen? The kit? Okay, perfect. All right, let's take the picture. Let's clap for them. That is UCU. Let me have Kampala International University. Let's be very fast. Kampala International University. For my dignitaries, you're going to stay up here because this is the moment. Kampala International University, let's be very fast. Let's be very, very fast. KIU. We're using the model, using the peers, going to the ground and making sure that everyone in their communities gets to know their HIV status. Okay, KIU. Others come this side. Let's spread. Guys, come this side, some of you. Okay. That's the moment. Let's smile, guys. Come on. Know your status. Come on. The DG is visible. Okay, thank you so much, Kampala University. Let's have UMU Nkozi, Uganda Matters University. Very fast, Uganda Matters University. DJ, you could have given us music that is very instrumental to the youth to make them really run faster. This is Uganda Matters University. Okay, this is Nkozi University. Let's clap for them. Abbott, that is it. That's the picture moment. Let's take the picture again. Just a minute, hold on. Let's take the picture again. Make sure your certificate is not upside down. I can't have this moment again. Okay, we go again. Picture moment. Let's all smile. Ta-da! Thank you. Let's have another university. Chambogo University. Chambogo University. Let's be very fast. Chambogo University. Chambogo University.
Girl, I'll be foolish if I don't let you indulge me. Your lips like poison. I'll take my chance with you. You're in denial. I'll show you I'm loyal.
Guys, you're blocking the minister. The minister is the chief here. Chambogo University. The minister is the chief guest. Make sure she's visible, or else the picture won't make sense to your peers. Okay. Is the DG visible? Excuse me, sir. Okay, now we can take the picture. Let's all smile. Chambogo, let's smile. Nice. Ta-da! Next university, Mobs University. Let's clap for Mobs. Mobs, please come. Mobs University. Mobs. Just read them among the peers. Faster. Mobs University. This is Mobs. Don't worry.
I'm in Josie. Won't call if you want one Josie. I'm not playing with you, I'm not joking. My thought of mom is loaded. Me, you can fight up, but I'm on board. I'm on duty, but I'm on low key. They want do me, they want do me, they want do me, cause they want do me. When you won't want me, when you won't want me, I'm in San Francisco.
Okay. Some can actually even squat down. Guys, let's be creative. Okay. Okay, to this standing here. That's better. Okay. I'm going to
She's my woman, inside Puna, sweet like sugar. In my new van, come to me, and they swim like tuna. When you won't want me, when you won't want me, I'm in San Francisco.
High Excellency Natalie Brown, you find it? Okay, let's take the picture. This is Moves. Let's all smile, Moves. Ta-da, thank you. Let's have another one. Makerele University Main Campus. Mook Main Campus, please come forward. Mook. Mook, please come forward. Let's be very fast. Mook. I'm not playing with you, I'm not joking. Please note that the self-testing kit, it has been translated. They want do me, they want do me, they want do me, they want do me. When you won't want me, when you won't want me, I'm in San Francisco, Jammy. When you won't want me, when you won't want me, I just flew in from Miami. Kindly hold your certificates well. Make sure they are facing rightly so. The flag is up. The flag is up. All right. Let's smile. Let's smile, Mook. Okay. Thank you. Ta-da. Next university. Ndeje University. Ndeje University. Let's have Ndeje University. Thank you. Ndeje University. Let's clap for them as they make their way in Ndeje. Ndeje University. Let's be very fast. This is in Deja University. Kindly hold your certificates up as we're flagging this up. Just hold your certificate up. Let's smile in DJ. Let's smile in DJ. There you go. There you go. Let's clap for them. Let's clap for them. Thank you so much. Ta-da! Next university, Nkumba University. Nkumba University. Let's clap for them as they make their way here. Nkumba University. Honorable Minister, the music playing is very instrumental to our youth today. It's a piano, that's why they're coming all excited. This is Nkumba University. Okay, let's flank our certificates. Let's flank our certificates. These are the peers we're having. Make sure it's upright before we take the picture. Okay, now we can smile for the picture. Let's smile for the picture. Thank you. Let's clap for them, ladies and gentlemen. Thank you so much. Let me allow the minister and the other dignitaries to take back their seats. Thank you so much. Well done. Let's clap for them. Let's clap for them. Thank you so much. Thank you so much. You've been very patient with me. And at this juncture, ladies and gentlemen, before you leave, allow me to just get 20 of your minutes, only 20 of your minutes, and pay attention to this skit coming up. That's going to be by the Positive Living drama group from Mulago. They are best at task. So let's clap for them as we welcome them. Just 20 minutes of your time. Thank you.
Fred, please give me. Fred,
you come back inside.
I'm not coming inside.
Get inside.
I'm not getting inside.
Sarah, if you know that I'm your husband who paid for your dowry, get inside and give my breakfast.
Fred, I'm not getting inside unless you accept to go for an HIV test or you use a condom.
Stupid. I said, just go.
Fred, leave me.
Okay, now I'm going to use force.
Fred, remember I'm pregnant.
Don't tell me.
Hurt me.
Fred! We go.
Fred!
I said we go.
Fred!
Get inside, Sarah.
Sarah,
you get inside.
Fred!
Sarah, you get inside. Kalisa. She's pregnant. Kalisa, it's good you have come. Let me tell you. What's the problem? I'm very annoyed. I don't know what's wrong with this wife of mine.
What is it?
Can you imagine
How
that?
can you fight a pregnant woman?
She has,
for God's sake.
She has denied it to me.
What?
Breakfast.
Breakfast?
Yes.
That's why you can change even your face.
Let me tell you, I don't know what's
Just
wrong
the
with women. By the way, I've reached the extent of calling the father to intervene.
Haven't you gone so far?
Why?
Calling her father?
I'm not
How
talking
can you
about,
call her father?
I'm not talking about her father.
Yes.
I'm talking about the parish priest.
For what?
Maybe to separate us. You know what?
Fred, you must be patient.
Let me tell you, the father might be even on the way coming. I don't want the father to find me when I'm naked like this. You come inside and I tell you more about this woman.
What you've done?
I'm telling you, women these days.
Mwana wange salo nswazizza nnyo. Gwe wamwe tebakubuulirira. Bw'oli ova wamwe tebakubuulira nti omusajja tamwa kantu. Bw'aba ajagala ku makya gimuwe oba mutuntu muwe. Ate oba nekisalabudde ng'omuwa ate n'ekyeggulo otyo. Oyagala kutuswaza obwenkaniddeawo omusajja bamumma. Saala kankule ne bw'agisanga ng'eri ku kyoto etokotanga ebiriridde bw'eti gimuwe mbadde yagigula.
Marita, it's true. You didn't understand me. I told you, like you say I'm pregnant. I went to the hospital for antenatal care. And while at the clinic, we were given information on HIV and AIDS. And we were told, if I take my husband to test together, they give us results together. And if we are positive, to prevent the infection to our unborn baby. So I came back, I told my husband to go for an HIV test. My husband refused. I went again. This time I was tested. Unfortunately, Marita was found HIV positive. I came, I told him, he refused.
Mpuliddemu akantu kogamba HIV. Bibadde bitya?
Marita, omanyi oluzungu?
Nze nasoma oluzungu gwolaba nze gye bagamba mbu SS simanyi S4 nze nafuna buna.
Marita, nagenze mu ddwaliro ng'omukyala w'olubuto okunywa eddagala. Ne batusomesa ku bya HIV. Ne batugamba nti omukyala bw'oba olubuto n'ojja n'omwami wo ne babakebera.
Era kati yenkola yeetaagisa okutereeza ensi okugwamu obulwadde bagenda babiri.
Ne bwe nakomyewo ne ŋŋamba omwami wange yagaanye. Ne bwe naze ne bankebera Marita nga nina akawuka. Ne bwe nagambye omusajja yagaanye. Nagamba ye talina budde bwayonoona kumala wiiki nga bamugamba komawo enkya komawo oluyonoone results omusajja yagaanye. Kyokka tamanyi nti nnyamba ye.
Naye abasajja tukole tutyo bamatiza nti buvunaanyizibwa bwammwe abantu babiri okutaatiriza omwana ali munda ali mu lubuto. Tatimanyi nti otaasa ye.
It is impossible. Kalisa, what's wrong with you?
It is possible.
No way. Kalisa.
Take my word.
Aha.
There are some things which we need to put in place. If really these people can do such a thing, it's possible.
Marita, Wama, is it true?
Sina tulundaba bulungi. Wanji?
Marita, you tell your wife. I'm asking. Wama Marita, is it true that you and your husband, that you bought a kit that is known as Checknow, and you tested there and then, and you got the results there and then? Is it true?
Nze nagambye ogwo ndaba ontya ntunula.
Nakugamba kali akantu ketwekebeza kenaleeta.
Kana akantu akapya ke waleeta ke bagamba nti okebererawo essaawa eyo n'otegeera ebivudde mu saayi abate takamanyi Fred nako weekali.
Let me tell you, this is a wonderful test. When we talk about testing, self-testing, we...
Amen.
All the time.
Mukama mulungi era ze embeera ze weewaawo.
We glorify his name. We take this opportunity to thank God who has gifted us a gift of life. We are alive and kicking. Many of our friends left us. Yes, my son.
Welcome, Father.
Thank you, my son, Fred.
Actually, you have come at the right time.
Are you sure?
Yeah. This is Kalisa, my neighbor, and that is...
Marita okyala Kalisa.
I need the blessings, Father.
It's okay, my son.
Now,
yes,
Father,
as you called me,
yes,
I was going somewhere to sell a sick. We call it okusigibwa kw'abalwadde.
Yeah. Anointing of the sick, yes. Yeah.
The anointing of the sick.
So I have no time. I decided to pass by so that you can tell me what's the problem. Is there any problem?
Father,
yes.
I think me and my wife, we have an issue. You, Sarah, introduce the issue.
I introduce the issue because it's me who has called him.
Now, my son Fred, I think this issue is about the married couple.
Yes.
I would request you to talk to your friends so they can give us
space,
some space.
Okay.
Yes.
Kalisa, you can be just give us space.
That is not good. That is not good, Fred.
We
are all part of the family. And your friend.
I'm going to call you back. And then the
father is chasing us here.
I'm going to call you back.
And we are the first people to come
here.
here.
I'm not chasing you.
Yes.
Kumeke bagamba batugoba wano fa basoose.
Ekyo tekisoboka nga ffe twakubirizadde olukiiko kati awo faza abasaze bwenkanya.
Marita, ndabayita. Temufaayo ngenda bayita.
Okay.
It's okay.
Okay. No. Come, let's go. No, come, let's go. And it's a good chance. I'm coming with the real things.
Hey.
Okay.
Yeah, you tell them we shall call them for a prayer.
Kalisa, please hurry up. Sarah, come here. Father.
Oh, how are you, my daughter?
She's here, Sarah.
I can see you. That's good.
Father,
Yes,
me and my wife, we have a very small issue.
a small issue.
Fred,
Okay.
you even call this one a small issue? Is this a small issue, really? Fred.
Father, it's like this, yeah? You know very well that this is my wife. And it's good, it's you who put us together.
Yes.
I think it's time you separate us. Because my wife has reached an extent of giving me orders in my house
Orders like what?
that if we are to eat, yeah?
Yes.
That I should start using a fork when we are going to eat. Can you imagine?
Oh my God. What's wrong with using a fork, my
Imagine
son?
if father at his
The
age.
whole you don't know how to use a fork?
At
Father,
his age.
Father,
Oh, my
maybe-
son.
Yeah.
There are some things which you have to learn.
Maybe you have not understood me very well. It's like this. Let me be very direct.
Yes.
My wife has started saying that if we are going to have sex, I should start using condoms. Can you imagine?
Jesus Christ.
Can you imagine?
My son, this is a clear indication that Satan has invaded your home.
Exactly. Satan has invaded this home.
Yes.
Yeah.
Sex was made for procreation.
Procreation, as you have
Yes.
said.
Now, when you use a condom, no child is expected.
Exactly. Have you
It's
heard?
a sin.
It's a
It's
sin.
a crime.
A crime.
To use a condom.
Uh-huh.
So can you humble yourself and we
Exactly,
pray?
Father.
Satan is
Let's
in the-
pray.
Oh. In the name of the
Father,
Father.
before you pray, Father, we shall pray later after resolving this issue. Father, infecting someone intentionally with a virus and using a condom, of the two, what is a sin and which is a crime?
Fred,
Yes,
who is HIV positive among you?
Father.
Yes? Okay. Can we humble ourselves and
Yes,
pray?
Father. Let's pray.
Okay. In the name of the
Father, before you pray, Father, if Fred doesn't accept to go for an HIV test or use a condom, Fred, Father, better do us a part. And it's good it's you to put us together. Do us a part.
My daughter Sarah,
Too much.
what God put together, no man can put
Father.
asunder.
Exactly.
We don't have that mandate of separating what God
Exactly.
put together. So we have to pray.
Yeah, exactly.
We
Let's
have
pray.
to pray,
Yeah.
okay?
Father, what if Fred goes ahead and rapes me?
My daughter Sarah, a man cannot rape his own wife.
Exactly.
Freddy,
wrong?
what were you trying to do? What were you trying to do?
Now, my son Fred, what you called a small issue, it's not a small issue.
Yes.
What I've seen here, this is a big issue. So I request that in the evening, if you get time,
Yeah.
you come to my office and
To your
solve this.
office?
Or let's do it like this. Let me go there and see the other sick. Then after,
You
I'll
come back here?
We have to solve this issue because there is something hidden.
Father, anyway, it's like this. It was all about time. Because my wife has been telling me that I should go for an HIV test. But me, I know that in the hospitals, you take a lot of time, they waste your time. And yes, for us as men, we don't have time going there that you are waiting for results of HIV. So, as I was talking with Kalisa, he told him that there are some kits that are used these days, that they are very good. You test there and then, you get the results, and they confirm there and then.
Are you sure?
They are known as
You
Check
get
Now.
your results instantly?
Yes, maybe let me call. Kalisa!
That's good.
Yeah, at least
Kalisa!
whatever you use, so long as you've tested.
Yes.
You come back. Yes.
Oh, this is Carissa.
This is Kalisa. Now,
Blessing, Father.
No, but this day I don't see them in a church sometimes. Are
actually,
they Christians?
actually, they are Christians, but they normally go to church on Easter and Christmas.
That's the
enough,
problem.
Fred. That is enough, Fred. Nagambye okusirikako.
Now,
Unswaza. Now, this is what I was telling you.
these are the kids.
Yes.
Oh my God.
Hold on, Father.
God is
This is something more especially for the people who knows everything. And you know, you according to the spiritual issues,
Yes.
this is I think okay. It's a check now. It's called a check now.
Checknow.
Yes, we have been,
Yeah,
we
it's good.
had many testing kits
Yes.
around, but this one is one of its kind.
Now, what's
First and
the
foremost,
difference?
The difference is this. This does not need any confirmatory test again.
Ah.
It gives you the real thing.
There and then.
The real results.
There and then.
There and then.
There and then.
Yes, and it's going to help for the youth.
Exactly.
You know, I managed to attend the launch. It was at Serena 2 weeks back. And then I was given the mandate to go courtesy of my child who is in one of the universities. So because for me I'm a VHT. So they said that let me at least move with it. But courtesy of my child who is the student who is what do you want? I have to, you know, we have to be very serious when teaching these things.
Carissa,
Yes.
I've already accepted. Since that you said that it's a test that is done there and then, I've accepted to have an
Great.
HIV.
You have accepted.
naye malita toyagaliza omusajja akkiriza okwekebeza ebbanga lyonna kati watu kati ogaana
kubanga buli musajja akkiriza okwekebeza oyo aba afuuse owonnamaddala.
Hey. Now, you may as not be a true man.
Father, you know these things, eh?
Okay.
They were made, excuse me, Father.
Yes.
Let me first
You
show
can give this Fred
I'm
so
going
that...
to give, but hold on a bit. Eh?
Okay, now
yeah, it
let's
was
sum
done by
ourselves.
the Abbott. Abbott did this.
It's
And
a
then
company.
the Ministry of Health, in conjunction with the Life Care, Diagnostics,
Okay.
now they are giving them, distributing them. But
Okay.
Father, there is one thing I
Yes.
always want to ask
You ask.
you leaders.
I
in
have
the
no
church.
problem with that.
Father, have you ever tested for HIV?
kaliisa bannange osobola otya okwogera ekigambo ku ekyo ekigambo oti olimba naawe agambye mbuno faza aliyekebeza kuba faza bawasa
Father, we are
fathers
sorry.
marry really.
Father,
How can you tell
we
a
are
father
very
to go
sorry,
and
Father. We are very
Kimanyi nti bagenda tujjako amasakalamentu batwala liri eryange lisigala.
Father
You
tusaba
people,
tusonyiwa.
you people.
Father.
That's no. Hold on. That's where you go wrong. Who told you that these are not human beings? HIV is for human. If then this one is the human being, he's a leader, and if we teach him very well and gets everything to talk about, then he can do. It's not wrong. He is a human being. He might be getting it somewhere. Maybe they are so caring, these people. Maybe he carried someone who... No. Let's hold on. You keep quiet.
On behalf of my family, I'm very sorry. On behalf of my family, I'm very sorry.
No.
It's like this. God is good.
All the time.
And all the time.
God is good, and that is in nature.
Wow.
Thank you so much. Now, my son Fred.
Yes, Father. We are sorry.
Kalisa, what he has done is good.
Yes.
Kalisa.
Okugamba no. Nokimanyi kyetegeeza. Father akkiriza nti enjogedde kituufu. Omwami watu alinnye waggulu.
Being a spiritual leader, and I'm a human being, it has no harm to get tested.
Knowing your status is very good, Father.
Yes. And I'm going to be the role model.
Exactly.
Today, I'm going to test myself using this kit. You said it's called what?
No.
You said it's Checknow?
Tukwetondedde Father munnange.
Kyagambye nuyogera yaki agambye akkiriza okwekebeza.
Father ngakkiriza okwekebeza maama ekyo kisufu kubanga ate Father kyotukoledde bw'oba okkiriza okwekebeza kati ekitegeeza n'abakulembeze banno bannaddiini bagenda kwekebeza era nkusaba Father otutuusiza obubaka buno eyo mu lukiiko lwammwe gye mubeera olugatta abanaddiini bafaaza simanyi abalevulandi abasumba bamasheeka tukusaba otubagambire nti basomese enjiri naye bagiteekemu naddala abavubuka abafaabo okubanga akantu kano ke baleese abavubuka abo kagenda bayambira dda abaana tebalina budde bugenda kusimba layini.
Yes.
ayogedde nga maama w'omuvubuka.
Yes.
So now Father, you have accepted.
Yes.
And you've at least educated everyone. Those who think that if you are a church leader, you don't need to go for HIV testing. So, Father, you can do it in your office.
But I don't know how much is this kit.
For now,
Yes.
as they are distributing it,
Yes.
you can at least go to these people. It's for free now.
Now, this way you're giving it to me for free?
You can do it.
Oh, thank you. God
That
bless
one is yours.
you. God bless you.
Bless you too.
So now, Carissa, you know what? Let's go inside and you demonstrate for us.
I'm going to do that.
Yes, how to use this.
I'm going to show you. Let's go.
We go?
Yeah.
Okay.
Together we will stand. Bridging the gap, together we will stand. Bridging the gap, together, together we will stand. Bridging the gap, together, together we will stand.
Let's clap for them once again. Her Excellency Natalie Brown, I'm sure you followed the synopsis of the storyline, but these are real stories in our communities. We don't believe that religious leaders need to test for HIV and AIDS. There is a separation of the patriarchy in homes that when a man wants sex, whether you're pregnant or you're not, you must submit. And this was one of the elements of the skit that was very vibrant to me, that men, we need to listen to our wives. At times, we must not depend on our wives. We should go and test regardless. Let's clap for them again. At this juncture, allow me, it's a few minutes past 11 p.m., rather a.m. Let me request that we all stand and we have the national anthem sounded, and thereafter we shall leave at leisure. Let's all stand up, comrades. Let's have the national anthem sounded and the East African anthem. Thank you. The national anthem. Okay. Correct, let's go.
Tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tulilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Let's have the national anthem sounded, please. Thank you, ladies and gentlemen. Thank you so much for coming. We wish you the best of your journeys back home. But in a special way, Honorable Minister, before you leave, I want to request the Abbott team to come and take this picture before the minister leaves. The Abbott team, please come up very fast. The Abbott team, and then the minister shall leave. The rest of us, please have the best of the journey. Please go get these kits. You'll find them at your pharmacies. And the ambassador, please come up. Let's have this picture. Charles Njaguna, please as well come up. You'll find these kits at your pharmacies. Not only that, at your supermarkets, just to make sure that they're very accessible and very affordable. Thank you so much. Have the best of the day. So journalists, in case you have particular questions, before the minister leaves, please, we have the spokesperson of the ministries here. We have the divisional head of Abbott is here with us. You can use this moment to have those interviews. Thank you. That is to the fourth estate. Thank you so much, Honorable Minister, High Excellency Natalie Brown and Juguna. Thank you so much. And thanks, DG. Thanks, the team from Abbott. Have a lovely day.